successful manner. This is part 2. In part 2, I'll be talking about cognitive behavioral therapy. Cognitive behavior therapy, or CBT, is another treatment method that can be successfully incorporated with motivational interviewing techniques. According to the National Alliance on Mental Health, or NAMI, cognitive behavioral therapy is a form of treatment that focuses on examining the relationships between thoughts, feelings, and behaviors. The process recognizes that a person's thoughts impact behavior and therefore works to disrupt the potential cycle that can develop when someone has consistently negative thoughts that contribute to negative behavior. For example, if a person is unhappy with a job and wants to apply for another job, yet does not carry through with the new job because of negative thoughts such as, I'm not qualified for the other job, the patient remains unhappy at work and does not move forward on the opportunity for a better work situation. This leads to a downward spiral because the patient feels worse about the job situation and his or her ability to progress or deserve anything better. These negative thoughts and emotions impact the patient's behavior into a continuous cycle of despair. Cognitive behavior therapy may be utilized for some women who are struggling with depression and bipolar depression. Cognitive behavioral therapy considers the patient's thought patterns and how they affect her behavior. A patient with severe depression may work with a therapist to use cognitive behavioral therapy to initially recognize negative thought patterns. They are taught that thoughts do not force a person to behave in one way or another. They are simply a process of thinking. By recognizing this, the patient can learn to make a conscious choice to act differently in spite of her thoughts and not let her negative thinking support depressed behavior. Cognitive behavioral therapy seeks to break this negative cycle of thinking by intervening to help a patient understand how personal thoughts impact behavior. Using this approach, motivational interviewing can be incorporated into cognitive behavioral therapy's techniques to promote change and address motivation in the patient. Incorporating cognitive behavior therapy with motivational interviewing may be a natural process because these methods are somewhat similar in that both of these methods, the patient and therapist, work together to formulate goals and come up with solutions to current problems. The process is active and involves both patient and therapist involvement. A patient's behavior, however, may indicate ambivalence toward change, negative thoughts, and a self-perception that they are incapable to change for the better. However, using cognitive behavioral therapy and motivational interviewing together, the clinician may be able to guide the patient toward change, to redirect their thoughts and feelings toward a more positive outlook. The combination of cognitive behavioral therapy through psychotherapy and the appropriate kind of medication for patients' condition can successfully treat and manage symptoms of depression, whether it's caused by major depressive disorder or if it's related to bipolar disorder. Alternatively, antidepressants take several weeks and probably as long as a month or two before they become effective in controlling depression. So, while waiting for your medication to be enabled and enacted, you can start doing the psychotherapy that I've already discussed. The patient who is prescribed antidepressants, may need to wait much longer before she starts to see change in symptoms of her illness. Women who struggle with depression as part of bipolar disorder are at a higher risk of self-harm and suicide, since they may struggle intensely with feelings of sadness and hopelessness during depressive episodes. The patient who experiences depression can benefit from a prescription of antidepressant medication for major depressive disorder, but could experience a rapid switch into mania if the depression is associated with bipolar disorder. As stated, careful consideration must be taken when prescribing medications for these patients, and the provider must determine whether major depressive disorder or bipolar disorder is present. Studies have shown that a combination of medication and psychotherapy is most beneficial for patients struggling with depression. Now, let me just go back for a minute to tell you about the difference between major depressive disorder and bipolar disorder. Now, if a person has bipolar disorder and they are really suffering from major depressive disorder, that can be a problem, and it can be a problem the other way around. So if someone is diagnosed with major depressive disorder, but they really have bipolar disorder, but they're only going through the depressive phase of the bipolar disorder, then the medication that is given for the major depressive disorder can exacerbate a manic episode. So you got to be very careful about what medication and what the diagnosis is before the medication is applied. All right. Patients struggling with depression is what we've got to figure out which is most beneficial for patients struggling with depression. Psychotherapy is helpful in treatment of depressed patients, whether the condition is major depression or bipolar depression. So, any type of depression at all that an individual may be suffering from, then you've got to understand and you've got to know that drugs in and of themselves are not going to cure your depression. Drugs are very helpful, and drugs are very useful in controlling some of the symptoms of depression, but it will not cure it. The cure for depression is in the talking therapies. You have to use the talking therapies if you are looking for a cure for your depressive condition, whether it's bipolar, major depression, post-traumatic stress disorder, or postpartum depression. Whatever type of depression it is, you need talking therapy to help cure the depression. Thank you very much. That ends my presentation for treatment.